The news day continues here on One News Now. I'm Riza Diaz. Circling back to our top story, 8 new UK variant cases have been detected in the country. To share with us his insights, we have with us via StreamYard UP Octa Research Fellow Father Nicanor Austriaco. Father, good evening.
Good evening, good afternoon in the Philippines.
We know that you are coming all the way or talking to us all the way from the States. That's why I greeted you. Good evening. Father, is it possible
Yes.
that, first question is it possible that there are more cases of UK variant in the country than what is being reported?
Oh, it's actually statistically very likely that what we are seeing now is just the tip of the iceberg. The new case, especially in the Visayas, is particularly troubling, but actually not unexpected because of the recent surge in cases there is typical of populations where B117 enters. So the surge in cases for the past few weeks is now best explained by appealing to B117. So B117 is probably in community transmission in Cebu.
Father, since you mentioned about the surge, are we seeing a surge in cases in areas where the new variant are reported?
So over the last month and a half, we have seen cases spike in Mountain Province, in Benguet, and now in Cebu. And what you have seen is that in each of these cases, we've been able to identify B117 variants in these populations. So it it will explain why all of a sudden a stable pandemic begins to surge. It's because of the introduction of this UK variant, which is 50% more transmissible and 35% more lethal.
Father Nick, is it possible that the surge in cases, let's say in Cebu, the past weeks was due to the emergence of the UK variant in that area?
I mean, it would explain why we have cases there and no cases, for example, in Metro Manila, because that has been a great blessing that we saw there is a gradual increase in cases, but you do not see the explosive increase that we have seen in Benguet, in Mountain Province, and now in Cebu. And the detection of the B117 variant explains why this is the case.
There is a lockdown, or there rather is lockdown in 5 barangays, Father, in Buntok will be ending tomorrow, Sunday. Are you recommending to extend it?
Well, I think the B117 variant is just like regular COVID. That after 2 weeks, you are able to exclude people from being infectious. So the hope is that I've not counted how many weeks it has been, but if it has been 2 weeks since the lockdown has been implemented, then that is standard worldwide practice for lockdowns. The question now is what will happen in Cebu.
With this being said, Father, what can be done to prevent perhaps the surges in areas with reported UK variant?
Well, I think the best way is the standard way. It's contact tracing, isolation, and quarantine. And to do this as quickly as possible to break the chains of transmission for this variant or any of the other variants. And so, the DOH is currently attempting to identify the history of that one case in Cebu. So hopefully they will be able to identify all of the chains of transmission and to break those chains rather quickly. Otherwise, that virus is just going to keep spreading in Cebu. And eventually, if we're not careful, it will go to the NCR because there are a lot of people traveling between Cebu and Manila.
Well, for your time and for your insights as always, thank you very much, UP Octa's Father Nicanor Austriaco. Now, as earlier reported, the new UK variant has been detected in Cebu. The Department of Health earlier confirmed that 2 individuals with addresses in Talisay and Liloan tested positive for the new COVID strain. Let's get more details on this. We have with us Dr. Mary Jane Loreche. She's Chief Pathologist and Regional Spokesperson for COVID-19 in DOH Central Visayas. Ma'am, thank you for joining us.
Yes, magandang tanghali po sa atin. Thank you also for inviting me to clarify some of the data that has been already mentioned.
Ma'am, let's start off with a patient from Talisay who we learned is a returning OFW. That's according to the Department of Health. Or what else do we know about that case so far?
So far, this patient, that is true that the patient or the OFW arrived here in Cebu sometime in January 18, and we conducted a swabbing upon arrival and tested positive, but the patient has remained asymptomatic. And so we sent the sample to the Philippine Genomic Center on the 23rd of January and received only the results yesterday. But this particular patient was admitted and quarantined in our facility and was transferred to one of our lead government facilities as a hospital patient because the patient was a diabetic and had to undergo a treatment of his diabetic foot. Patient was discharged from the hospital on February 2, well and about, and now is in Talisay. Meaning to say, this particular OFW never set foot in Talisay from the time of arrival until after we have discharged him as clinically recovered and well.
Okay. How about the case, ma'am, in Liloan? We also found out earlier that this is still an active case. So we'd like to know what are the possible reasons this individual got infected?
Okay, for that patient or individual coming supposedly from Liloan, this is the dilemma. The person or this individual never, had the test done here in Cebu. Meaning to say, we only learned that this particular individual has a final address of Liloan, Cebu province. But the test was conducted in Manila at the Lourdes Grace. There's a molecular laboratory there that conducted the testing sometime in January 17 and turned out to be positive. So we do not have details why the sample was sent to the Philippine Genomic Center for sequencing. Neither do we have data on whether the patient or the individual stepped, here in Cebu province. Right now, what we have is to coordinate with the LGU to check if this particular individual really came home or was here in Cebu province prior to the testing or even after the test results was released.
So, ma'am, you've mentioned you're coordinating already with concerned local government units about this. And what other measures are already in place to prevent the further spread of this new variant?
Even before the results were out, we have been, we have already conducted and we are ongoing conduction with our biosurveillance. Last week, we already requested for approval to conduct biosurveillance, wherein we collect samples from individuals who come from clustering of cases. Secondly, on the pediatric patients, because we see that there are now pediatric patients testing positive for COVID, and for the cases that we tagged as reinfection, meaning to say individuals who tested positive previously 3 months ago and is now positive again for COVID. And so we have gathered samples based on the criteria that we have also set, like a cycle threshold of 30 and below, a positive PCR result, and thirdly would be a volume of 500 microliters. And so we have actually 70 samples that we have already gathered from January 30 up to February 2, and we are sending these samples to the Philippine Genomic Center today. And hopefully they would be able to run this and we would have a result 1 to 2 weeks from today. And so by then we would already know if they're based on this biosurveillance that we have conducted on how far the UK variant is in terms of being present in our place.
Doc, we know that the studies are ongoing, but based on the data that you have so far, are you looking at the possibility of community transmission of the new UK variant in Cebu?
Yes, we have always been saying that when we noticed our triple digits and the consistent rise in our numbers, we were already thinking that 2 things is happening here. One is the probability of the UK variant that we are missing out. Because remember that we do not conduct genomic sequencing here regularly in the Philippines. Secondly, there is also the possibility that there is another variant that is local in nature. Remember that your SARS-CoV-2 being an RNA virus, coronavirus being an RNA virus, being an unstable virus also can actually undergo mutation at a given point in time, particularly when there is so much transmission going on.
Well, thank you for all those information. That was Dr. Mary Jane Dureche, Chief Pathologist and Regional Spokesperson for COVID-19 in Department of Health Central Visayas. The World Health Organization confirmed that the number of vaccinations have surpassed the total infections worldwide. However, the WHO said that around 130 countries have yet to administer a single dose. Other countries are ready to conduct mass vaccinations, but shortage in vaccine supply is delaying the rollout. The WHO also notes a need for massive scale-up in vaccine production to address the supply gap. Now, a member of the Center for Media Freedom and Responsibility calls NTF-ELCAC spokesperson Antonio Parlade's red tagging a failure of common sense. In an interview with One News, the chief CMFR member Vergel Santos slammed Parlade over his remarks on an Inquirer reporter. Parlade posted on his Facebook account that the Inquirer report on Aitas being tortured were misleading as he claims it never occurred. Parlade then labeled the reporter a propagandist of the Communist Party of the Philippines and implied that charges can be filed against her for aiding the terrorists by spreading lies. Santos believes that Parlade is part of a strategy to intimidate not only media but detractors and dissenters as well.
And the problem is that we seem to be taking these things isolatedly. When you have a list coming, you have Parlade coming on and indicting just about anyone the regime fancies. It should be taken in the context of a larger scheme, which should include, one, the militarization of the bureaucracy, two, the draconian anti-terrorism law, and three, precisely that, the red tagging.
Now, here are other stories we're keeping our eyes on. Manila Mayor Isko Moreno believes leaders should offer to be vaccinated first. He adds that it is one way to ease the fears of the general public in taking the vaccine. The city of Navotas held a dry run of COVID-19 vaccination rollout. The dry run was held at Navotas Polytechnic College, where the city will store its procured vaccines. Mayor Toby Tiangco says this drill will help them assess their readiness for the citywide immunization program. And a German veterinary clinic has trained German sniffer dogs to detect COVID-19 in saliva with 94% accuracy. These dogs are conditioned to sniff out corona odor that comes from cells of infected people. Sniffer dogs are currently being used to detect the virus in Finland and Chile. Veteran Hollywood actor Christopher Plummer died on Friday morning, and he was 91 years old. Plummer passed away peacefully at his home in Connecticut with his wife Elaine Taylor at his side. He was best known for playing Captain Von Trapp in the musical Sound of Music. He also became the oldest actor to win an Oscar back in 2012. Now, those are the top stories of the hour. Join us again later at 1 p.m. as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. We are One News.